Okay, here we go. As I was saying before the video cut me off, I do apologize for that. Sometimes when you see celebrities or just anybody who does a lot of skincare routine and stuff, you will notice that their face looks very nice and young. But you will notice that you can notice the age on their neck and their décolleté. So that's what this is talking about. A lot of times their face is really nicely preserved, but you can see that aging around that area. A new phenomena that is actually not that old is technic. And it's basically caused by the repeated movement of looking down at your cell phone. So if you notice, a lot of us now will have those like lines or creases in the back of our neck. And if you were to go back to before the cell phones, when people didn't have cell phones, nobody had that. That did not exist. It was not a thing. It wasn't until the cell phones were invented and people started using the cell phones and looking down and up that it caused that technique. So that's a really interesting fact. Next, we're going to look at these wonderful skin conditions. So there's many of them, and we're just going to kind of go through them. I'm just going to give you a little brief description of them. So first, we have acne. Acne is sebaceous breakouts from hormonal changes or other factors. Next, we're going to have actinic keratosis, and that's going to be a rough area resulting from chronic sun exposure, sometimes with a layered scale of scabs that sometimes falls off, and it could be precancerous, so we need to watch out for those. We have aging. Aging are characterized by skin laxity due to collagen and bone loss, thinner skin, dryness, photo damage, and fine lines or wrinkles can be present with aging. Asphyxiated. Smokers have asphyxiated skin from lack of oxygen. So smoking causes lack of oxygen and that goes to your skin, so it asphyxiates your skin. It is characterized by clogged pores and wrinkles, dull and lifeless looking skin. We have comedones. So comedones, open comedones, which will be blackheads, clogged pores caused by a buildup of debris, oil, and dead skin cells in the follicles. And then you have your closed comedones, which are referred to as whiteheads, and the difference is that they're not open. So remember, it's the same thing. The only difference is that with those blackheads, it is open, so it is exposed to the oxygen, which causes oxidation in the comedone, and it causes that blackness of the comedone. Because if you notice, whenever you extract a blackhead, the top part, the part that was exposed to the oxygen, is going to be black, and underneath it'll be just like a white head. Next, we have Couperose skin. So Couperose skin is redness in the skin with no visible vascularity because the matting of blood vessels is so small and fine, and it's often seen with telangiectasia. We have cysts, which are fluid, infection, or other matter under the skin that is encapsulated into a palpable firm mass of varying size. It can go from pea to a golf ball, so very small to very large. Dehydrated, so lack of water caused by the environment, medications, topical agents, aging, or dehydrated drinks such as caffeine and alcohol. So remember, caffeine and alcohol will dehydrate your body, they will dehydrate your skin, so it's very important that you stay hydrated. Enlarged pores, just large follicles due to excess oil and debris trapped in the follicles, or expansion due to elasticity loss or trauma to the skin. Growths. So your growths are going to be skin cells and underlying tissue that overproduce and create an area that could be raised or flat, but can be distinguished with palpation. Next, we have, remember herpes simplex 1 and 2. We did talk about those. A communicable virus. So remember, communicable means that it can be passed on from one person to the other. So it appears as a vesicle on the lips, similar to a blister. And then you have, let's see if the other one's next. Hirsutism. I am probably pronouncing that horribly. Excess body hair located in regions where hair is not normally present, such as facial hair for women. It can commonly be caused by hormonal imbalances or PCOS as well. It is a possibility. Remember, we talked about that, and we talked about the importance of making sure that your clients that come in with any conditions like this, you're very tactful in how you speak to them, and they just want to feel confident in their own skin, and your job is to make them help them achieve that. Hyperkeratinization, that's going to be an excess buildup of dead skin cells or keratinized cells. Hyperpigmentation. Hyper is overproduction of, remember. So overproduction of melanin due to some factors. So it can be UV exposure, it can be hormonal, it can be any post-inflammatory or PIH. It can be caused from an injury to the skin, acne lesion, insect bite. So there's many different reasons. But it's important that you know that hyper is an overproduction of. Hypertrichosis is referred to in any excess hair growth, whether it is caused from a hormonal imbalance or whether it's hereditary. And then you have hypopigmentation. So hypo is the lack of production. So lack of melanin production. Again, it can be UV induced. It can be post-traumatic. Vitiligo is a condition. Albinism is a condition. So those are some of the conditions. Irritation. So irritation is usually redness or inflammation from many different causes. So that's just a simple one. Keratosis pilaris. Keratosis pilaris is a buildup of cells, and it has a rough texture to it. Melasma. We talked about melasma, most common in pregnant women. A form of hyperpigmentation that is characterized by bilateral patches of brown pigmentation on the cheeks, jawline, forehead, and your upper lip. It is due to hormonal imbalance, such as pregnancy, birth control pills, or hormone replacement therapy. And melasma can get worse with sun exposure. And remember, a lot of times your pregnant woman who develop melasma after they give birth, it goes away. Milia. They're hardened pearl-like collections of oil and dead skin cells trapped beneath the surface of the skin. They're not exposed to oxygen and have to be lanced to open and remove them. Remember, we talked about that. You can go in and do the lancing or, perforate it in order to extract it. However, we did say if it doesn't come out, leave it alone. With cleansing, repeated, and exfoliation, it will eventually just cease and heal itself. Papules. So papules are raised lesions, and they're also called blemishes. Poikiloderma of civata. I am probably saying that horribly wrong, but it is a result of chronic sun exposure, specifically along the side of the neck, which turns a reddish brown color with a clear demarcation of untanned skin under the chin. We have pore elasticity, is skin elasticity from damage, sun, and aging. And this is just a test that you can do. Basically, if you go like it's showing in the image, you grab that skin on the top of your hand and you pinch it up and then you let it go and you can see the elasticity in your skin. Don't quote me on this. I'm pretty sure it is, but also I think that can help you determine like if your skin is either hydrated or dehydrated. But I will double check on that one. Our next one is pustules, or pustules are an infected papule with fluid inside of it. And then our scars. So scars are pretty self-explanatory. It's just a mark on the skin where a wound happened. Sebaceous hyperplasia. Sebaceous hyperplasia is a benign lesion seen in oilier areas of the face. They're described as looking like donut holes, and they cannot be extracted. Seborrhea. Seborrhea is going to be an excess oil production that causes redness, irritation, and flaking, and can occur most commonly in the hair, and it's known as dandruff in the hair. Sensitivities are physical reactions. It can be like edema, welts, itching, discomfort from internal or external influences on the skin. We have solar comedones. So solar comedones are large open comedones, and they're usually around the eyes due to sun exposure. Oh my goodness, this picture. I can just imagine doing an extraction on this person and it would be so satisfying. Okay. Stria, that's going to be a dermal scar due to rapid, or basically a stretch mark is what it is, but it's dermal scar due to rapid expansion or stretching of connective tissue, leaving deep red, pink, or purple marks on the skin that gradually fade to lighter pink or silver over time. And a lot of times they happen during pregnancy. Sun damage, UV damage to the epidermis and dermis, primarily effects are going to be wrinkle, collagen, and elastin breakdown, pigmentation, and cancer. So like that image I showed you of the truck driver, the visible sun damage on his skin compared to his normal aging process to where the sun damaged on his left side of the face. We have telangiectasia. Telangiectasia are visible broken or distended capillaries. They're less than 0.5 millimeters due to intrinsic or extrinsic causes. And last but not least, we have wrinkles and aging. They're lines and damage from internal and external causes as well. Okay, so being aware of what can affect the skin will help you determine why a client may be experiencing problems. And often the skin conditions are due to many influences or factors. So it can be external as well as internal factors. Remember, we said everything is connected. So the way they eat, their physical activity, where they work, what they're around, if they're around any chemicals, anything like that will influence the skin. So internal and external and internal factors, always keep that in mind. That's why it's very important for you to do that consultation with them and ask all those questions about what their habits are, about where they work, about just, any medical conditions they might have. everything like that. Now, some healthy habits. Some healthy habits, there are 10 that are described here. So avoid sun exposure and use sunscreen daily. Eat a balanced diet. No smoking. Avoid excessive alcohol. Drink plenty of water. Get plenty of rest. Stay active and exercise regularly. Use beneficial skincare products and a regular home care routine. Get professional skincare treatments to maintain the results of your home care regimen and to more effectively treat the signs of aging, blemishes, or other skin conditions. And implement stress relievers and maintain a calm, positive attitude. Very important. Let's see what else we have here. Contraindications. So contraindications are certain treatments and skincare products may be contraindicated for a particular client, and it is your responsibility to evaluate the appropriateness of treatment and skincare products after your skin analysis and review the client's medical history. So let's look at what some of these contraindications might be for your clients when performing a. All right, so an example, if your client is using any topical medication like Retin A, Renova, Tasserone, any of those, you want to avoid any waxing, exfoliation, and peeling treatments for a minimum of a week after they've used the medication. For your clients who are pregnant, you don't want to do any electrical treatments, no chemical peels, nothing with aggressive ingredients, without making sure that their medical provider has given them permission to do these things. But electrical treatments, no, that's a big no. Some pregnant clients will experience sensitivities from waxing as well, so just be very careful with that. Any clients who have any metal bone pins or plates in their body, you want to avoid any electrical treatments in the area where the pin or the plate is located. Make sure that you have clearance from the medical professional for that as well. So you always want to ask them, do you have any metal pins or anything metal in your body? As well as if they have braces, you also want to avoid any electrical treatments. Any pacemakers or heart irregularities, you want to definitely avoid medical treatments for that as well. Make sure you know any allergies that your client might have and avoid any products that will trigger that allergy for them. Seizures and epilepsy are also a big one for avoiding electrical or any light-based treatments that will pulsate. If your client is using steroids like prednisone, you want to avoid any stimulating, exfoliating treatments or waxing because the skin will be more fragile and it can bruise easier. So until they have been off the medication for at least 2 weeks, you don't want to do any of those services. That would be a contraindication. If they have diabetes, people with diabetes who do not have good control of their insulin levels will experience lower healing. So be very careful with that. If they experience nerve damage to the extremities, they may not feel pain in the affected area. So if you're in doubt, just get approval from their medical provider before treating them. Blood thinners. If you have a client who is on blood thinners, use caution when you're performing extractions and when you're doing waxing. Very, very important. Remember that these are non-steroidal anti-inflammatory drugs or over-the-counter medication. They are used to reduce inflammation. So things like ibuprofen or things like that, they will be blood thinners. So just be very careful with those clients. All right, let's see here. So I just want to touch base on a few points, on a few reminders on how to prepare for that client consultation. So you want to make sure that your client is comfortable. You're about to begin an important conversation with them, so you don't want to just be standing in the hallway having this conversation. Make sure they're seated comfortably in the room, in the treatment room, and you're there with them. Make sure that your work area is freshly clean and it's uncluttered. Clients pay attention. Make sure that other appropriate tools to perform the desired service are ready to be used. And do you have a pen, a laptop, tablet, along with supplies, salon manufacturer pamphlets, photos, articles, anything that you want to provide your clients? So make sure you have all your information there. Make sure you have a pen to take notes, or if you use a tablet or a laptop, make sure you have that with you. Do you have your step-by-step photos of the actual treatment process, or explain the process to the client, especially if they are first-time clients? Will you be able to discuss who the best candidates are for specific treatments to help decide if the treatment is suitable for the client? Let me go back for a minute. So those photos, always remember that you have permission from your previous clients to show those photos, okay? Don't just snap pictures and then show somebody, oh, look, this is a progress. You always want to get permission from your clients if you're going to be showing their photos to somebody else, or if you're going to be displaying them, in your social media for before and afters. Very important. So your forms, remember, you have your intake form. So your intake form is going to have the health history of the client. It's going to be the first form that they submit. It's going to list their history, any allergies or sensitivities, any at-home routines or products that they use. It is also important to include details about the client, like name, age, occupation, diet, and lifestyle, so that you can refer back to those to do a holistic consultation, basically looking at the client as a whole in everything. Next, you're going to have your consent form. So this is just like a written agreement between you and the client for the treatment. So they will acknowledge that they understand that what is being done to them, as well as the risk involved in the treatment, and releasing you from any liability before you perform the service. And then you have your client chart or service record card. This is where you're going to track that client. So you're going to have a record of all your notes from skin analysis, the type of skin they have, any treatments that you've performed on them, what their ultimate goal is, and kind of what the progress is, what the progress has been or is throughout their treatments or their sessions with you. Remember, you want to tell your client if it's their first time to arrive 15 minutes before their appointment, so that you can use those 15 minutes for the client consultation. You can go over the forms, answer any questions they might have, just get them comfortable, anything like that. So some questions that you can ask during the consultation are going to be as follows. So what is the reason for your visit? What brought them in? Do they just want to relax, or is there a specific treatment that they want, or a specific something that they want to treat in their skin? What are your skin concerns? What are your skincare goals? What is your home skincare routine? Do you have any allergies? What does your skin feel like during different times of the day? A lot of times your skin will be a certain way in the mornings when you wake up, and throughout the day it will be differently. So make sure you ask them that. Tell me about your diet. What do you eat? What kind of diet do you have? Do you drink plenty of water? How much water do you drink? Remember, we talked about how to determine the amount of water you're supposed to be drinking. Your weight divided by half, and then you get that and you divide it by 8, and then that's the amount of 8-ounce glasses that you should be drinking a day, only to exist. Remember, it said just the basic existing, just walking, breathing, that's how much water you need. Do you smoke? Do you have any allergies? How stressful is your lifestyle? Have you had an aesthetic procedure before? Is this your first time? How long ago? What type of procedure did you have last? Those kinds of questions. Once you do that, you can perform the skin analysis, get your client situated and ready to start, and you're good to go. So, a little review for the skin analysis. You're going to review the client's health history and questionnaire. You're going to look at their medical conditions. And while you're reviewing the documentation, you can ask your client any questions for clarification. You're going to then wash your hands, properly wash them. You're going to look briefly at your client's skin. Make sure you look at that neck and the chest area as well, just with your naked eye. So we're not using anything at this point. We're just looking at the skin. But remember, we should have been looking at that skin the moment the client walked in. We're going to go in and we're going to cleanse the skin. Once we cleanse the skin, we're going to cover their eyes with the eye pads. Remember, if your client tends to blink a lot or they have anxiety, a lot of times it's hard for them to have those eye pads on them. And a lot of times they won't tell you, but you will see it. Because a lot of people that have anxiety, they'll feel like with you covering their eyes, they feel like they're asphyxiating. So they will start like blinking or breathing a little heavy. Talk to your client. Make sure you ask, is this okay? Do you want me to remove them? A lot of times you're just going to have to take those off and let them know, hey, this is going to be bright. Just, the light is going to be bright just so that they're aware of it. Use a magnifying light to examine the skin more thoroughly. You can use a Woods lamp or electronic imaging system as well. You're going to look closely to determine the client's skin type, the conditions present, and just the overall appearance of the skin. The next thing we're going to do is we're going to touch the skin with our fingertips to feel its texture. Somebody asked about the gloves. Yes, it's important for you to use gloves, especially when you're taking your exam, your state board. But remember, like I said, for me, it's really hard to feel that texture of the skin with the gloves. So once you're in the salon, I don't use the gloves to feel that texture of the skin or to do that initial skin analysis. Just because you can't really feel it. It's not the same. It's really not. You want to ask and listen, ask questions about the skin's appearance, the client's health, anything like that. So any other questions you might want to ask at this point, since you've already analyzed the skin, you can ask them. You're going to then apply a toner and a moisturizer or sunscreen to balance and protect the skin. You're going to recommend a skincare plan that includes any professional treatments, any at-home products that they want to use, and you're going to record your findings and your recommendations in the client's chart. So make sure you do that. And then before the client leaves, you want to make sure you schedule them for a follow-up for their next appointment. Okay, and that is it for chapter 5. I hope that you guys like this PowerPoint presentation style. I think it was way much better for me. It did take me a little bit to kind of put it together, but I figured that it would be easier for you guys to visually see it and follow along, especially because sometimes in the book, I'm not reading word by word what's in the book. I'm kind of taking the main points, summarizing it, so it might be a little hard to follow. So with this, I hope you like it. Give me any feedback on how you felt about this. I can just continue doing the recorded lectures on Thursdays this way if it's easier for you.